Okay, what we're gonna think about now is how to get our entire core system to engage during pregnancy so that we can maintain it throughout the remainder of your pregnancy, but also so that it is something you can start to work on postpartum and it's not super unfamiliar to you, because your body might feel a little bit unfamiliar at that point, but you've already started to practice this type of breathing, and so you can start to access it in that early postpartum recovery phase. So basically what we're going to try to do is get the pelvic floor down at the bottom to move and coordinate with the diaphragm, a big breathing muscle at the top, right? Which can often in the later parts of pregnancy start to get a little bit smushed, so it might feel like you have a little less room to breathe, right? But we can still use that diaphragm and movement, which can help open up a lot around the rib cage and around the abdomen to give you a little bit more space at the same time and relieve some other symptoms that you might be experiencing. So we're going to try to get the diaphragm and the pelvic floor to move together and have the abdominal muscles come into play as well. So it's this deep core system that we're going to start to train and work together. So to start, what we're going to picture is first with the inhale, the diaphragm muscle is going to move down and we're going to kind of fill up around the abdomen, and we're going to have that pelvic floor move down and relax as well. So everything kind of moves down and out together like you're filling up a balloon. And then on the exhale, that diaphragm is going to come back up, the pelvic floor muscles are going to come back up, and then we can engage those abdominal muscles to wrap those in. So now we're kind of contracting around, up and in, as if you're shrinking that balloon, right? So inhale, we're getting a nice expansion. Exhale, we're getting a nice contraction and compression. So what that can look like, I'll do this sitting here first, and we'll try it in a couple different positions. So you can do one hand on the kind of top part of your belly or by your rib cage, and then you can do one hand a little bit lower down. And if you're sitting, you can really feel in around the pelvic floor and perineal area how those pelvic floor muscles are moving, if you're getting any pressure into the ball or not, right? So we're gonna take that inhale and we're gonna think 360 degrees around. So not just a super big belly breath, but all the way around, okay, as much as you can. So the rib cage comes out, the belly does expand. I can feel a little bit of that breath around to the low back as well. I'm feeling the pelvic floor muscles start to lengthen and drop down into the ball. And then I'm gonna exhale. And I'm thinking of hugging the baby around, right? Or lifting the pubic bone up towards the belly button, wrapping the rib cage around. And you can either try blowing out through the mouth, like you're blowing out birthday candles, to help get that deep transverse abdominis muscle engaging, or you can breathe out through the nose if that's more helpful for you. Okay, so inhale, letting everything drop out and down, and then exhale. Feeling a nice lift from the pelvic floor all the way up and around. So I'm not sucking in, I'm just drawing up and around to help get that deep core system coordinating together. Okay, so one more time here. So it should feel like a light pelvic floor contraction. It shouldn't feel like you're gripping or really trying to pull everything in super tight. It should just feel like you get a little bit of a nice contraction there as you are getting some tension around the abdominal muscles, and then again on that inhale, letting that go. So now if we try that on our hands and knees, it's going to look like this, okay? So you can see my belly nice and relaxed here. We're gonna take that inhale to feel, again, the rib cage and everything expanding 360 degrees around. And this could be a nice place to think about letting the sit bones or the tailbone grow long and spread away. And then exhale. Gentle lift of the pelvic floor, feeling that contraction and hug around the belly. You can see that lift up a little bit. So we'll go through a couple breaths here. Breath in, letting go, and then breath out. Lifting up, hugging in. Okay, so that's a very nice foundational pelvic floor deep core breath that is really going to draw in everything from the diaphragm, the transverse abdominis, the spinal muscles, and the pelvic floor to give you nice supportive stability around the trunk, especially during pregnancy, throughout the remainder of that, but then also again to set up for that postpartum recovery, because then that becomes a breath that you can use during so much functional activity, whether you're standing up, lifting the baby up, getting the baby out of the crib, putting the baby into the car seat, getting up from the chair, all of these things that require stability and support, especially when we might be in a period where it's hard for us to access that. So thinking about using our breath, using that exhale to engage before we move can be a really nice supportive strategy to give you a little bit more stability.